Hi, welcome again to Scientia Nursing. This is your tutor, Nurse Judy. We are going to be starting a pharmacology series, and we will be starting with cardiac medications. The first class of medications we're going to be discussing are antihypertensives, and the first of it is ACE inhibitor. ACE inhibitors are medications whose end goal is vasodilation, but they go through a process. ACE, ACE on its own, without being inhibited or stopped, is a process in the RAAS mechanism that causes vasoconstriction. By the way, most medications that fall under this category end with PRIL. Those are your lisinoprils, captopril, enalapril. You get the gist. ACE stands for angiotensin converting enzymes. Angiotensinogen is a protein which is usually inactive and splits to angiotensin 1 that has to be converted to angiotensin 2 for vasoconstriction. That may be a little confusing, but it's not that hard. Angiotensinogen is the protein, but it has to first be split into angiotensin 1 to be active, and then to cause vasoconstriction, it has to be converted to angiotensin 2. You only want vasoconstriction if you want to increase blood pressure. That's where your ACE inhibitors come to play, because they don't want to increase blood pressure, they want to reduce the blood pressure. When the ACE is inhibited through the ACE inhibitors, vasodilation occurs and the blood pressure is reduced because the blood is flowing with less pressure. Imagine opening up a tight vessel or widening a narrow path. The common side effects of ACE inhibitors are A for angioedema, C for cough, E for elevated potassium. Let's talk about angioedema. Vasodilation can cause fluid to leak out of the vessels, causing swelling, otherwise known as edema. Cough. The inhibition of the conversion of angiotensin 1 also stops the breakdown of a protein called bradykinin. Bradykinin, when not broken down, accumulates in the airways, irritating it and causing you to cough. Elevated potassium. In the RAAS mechanism that is supposed to cause vasoconstriction, the hormone aldosterone is released to help in the secretion or excretion of potassium. When this process is altered by ACE inhibitors and vasodilation occurs, potassium tends to accumulate in the bloodstream. The other side effects of ACE inhibitors are hypotension, as you can imagine, and dizziness. Nursing consideration. You need to monitor the blood pressure to prevent hypotension, and you need to monitor the potassium level, the serum potassium level. Note, ACE inhibitors cause fetal toxicity. Therefore, it is contraindicated in pregnancy. This brings us to the end of today's tutorial. Don't forget to comment, like, share, and most importantly, subscribe to my channel. Thank you and see you in the next video. Bye.